HHS and the Department of Commerce announced that they would create an integrity working group to review March in authority. Are they out of their minds? We don't need a study group to see this price gouging and this sin and the shame, because this goes on the sin and the shame list. So Jackson, I, for one, don't understand why they wouldn't step in and use their authority, especially because this drug was paid for by the taxpayers completely.
Well, this is just an example of how the Biden administration has dropped the ball multiple times where he had an opportunity for very easy wins. The railway situation, back in the railway workers' request for more time paid off, more sick days. That was a very easy layup that would have helped his campaign and also really helped out the Democrats. This situation, I mean, $190,000 a year price tag, even if you make, let's say you're bringing in a couple $1 million a year, that's still a lot of money. Because like even if you're a millionaire, your money's not just sitting around doing nothing necessarily. Maybe some of it is, but it's probably in assets. Like that's really not affordable for anybody unless you're like a serious, hefty millionaire. It's just totally unaffordable. And then the 5-time markup price rate is just completely arbitrary, and they're doing it because they can. So, right. Biden's signature accomplishment, the student loan debt, that may not happen. So other than that, him freeing nonviolent marijuana prisoners is kind of all he has to ride on. But keep in mind, the Trump administration is absolutely, the Trump campaign is going to focus in on this pharmaceutical argument, even though Trump fell short of that too. He campaigned on it last time.
Yeah, he definitely fell short. There was so much he could do with all that bravado, as we were talking about before the show started. It would be nice if Trump had used that for the good, but he decided not to. And in the case of what is happening with this administration, it makes no sense whatsoever. They say one thing and they're absolutely doing another. America, you need to pay attention to this. Now, Secretary Becerra said, March in authority is a powerful tool designed to ensure that the benefits of the American taxpayers' investment in research and development are reasonably accessible to the public. We look forward to updates from the Biden Integrity Working Group, and at my direction, HHS will review the findings, engage the public, and better define how HHS could effectively utilize our authority moving forward. Let me just dress this up for you, America. That's hogwash. It's a bunch of BS. It's a bunch of stalling. It's a bunch of double talk. It's a bunch of we ain't gonna do a daggone thing here. We're not gonna do anything, and we're gonna let this pharmaceutical company get away with not only gouging the American people, but certainly some people are gonna die because they won't have access to this medicine. That's what this is. Now, Robert Weissman, the president of Public Citizen, tweeted this in response. This is pathetic. You know that's right, Weissman. The Biden administration today had the opportunity to use its existing authority to take the most meaningful action in memory to lower drug prices. It refused. Instead, it has launched a review of that authority. It's BS, America. Look, this is what we got to understand. These politicians say one thing when they run for office, and most of them, far too many of them, do a whole different when they get in office. We're not talking about somebody that doesn't have the authority. The administration has the authority, y'all, and they are refusing to act. You hear that? Refusing to act. And that should cause the hairs on the back of all of our necks to stand up. This is truly unacceptable. Totally unacceptable. So, other countries, why is it? Why is it? Because this definitely fits in the sin and shame category. Y'all know I got a category going. Santa Claus had who's been naughty, who's been nice. I got the sin and the shame category. So feel free to send us some messages about who else should be in that category. Why is it that other countries can do this so much better? We are the hegemon nation, but yet we are being outdone by other countries when it comes to healthcare and also access to pharmaceuticals for our people. As a nation, we don't only have to reimagine the healthcare space, we must demand with our words and with our deeds a new social contract in the United States of America. The current course our country is on is not tenable. It is untenable financially, and it is immoral.